Introduction. The combination of cobamamide and thiocolchicoside serves a dual therapeutic role, providing both neuromuscular relaxation and cellular metabolic support. Cobamamide, a coenzyme form of vitamin B12, enhances cellular energy and metabolic processes, while thiocolchicoside, a muscle relaxant, alleviates musculoskeletal pain and spasms. Uses. This combination is typically used for managing chronic muscle spasms and pain associated with neuromuscular disorders, providing muscle relaxation and reducing stiffness in conditions like back pain, spasticity, and traumatic injuries, supporting cellular metabolism and enhancing recovery in conditions where vitamin B12 plays a role. Mechanism of action. Cobamamide acts as a coenzyme for essential metabolic enzymes involved in the synthesis of DNA, fatty acid metabolism, and red blood cell production. By enhancing cellular energy production and metabolic pathways, it contributes to general health and recovery. Thiocolchicoside works by binding to the GABA receptors in the central nervous system, promoting muscle relaxation and reducing spasms through inhibition of spinal reflexes. It has anti-inflammatory and analgesic properties, further aiding in muscle recovery. How long does it take to work? The onset of action may vary based on individual conditions. Generally, thiocolchicoside starts showing muscle relaxation effects within 1 to 2 hours after oral administration, while cobamamide supports metabolic processes over several days with consistent use. Absorption. Cobamamide, absorbed in the small intestine through active transport mechanisms, especially when taken with food. Thiocolchicoside, rapidly absorbed when taken orally, with peak plasma concentrations reached within 1 to 2 hours. Route of elimination. Cobamamide, primarily eliminated through the urine. Thiocolchicoside, metabolized in the liver and excreted mainly through the urine, with some excretion via feces. Dosage. Dosage should be individualized based on patient needs and the severity of symptoms. Commonly prescribed regimens involve oral administration as tablets containing both cobamamide and thiocolchicoside. Administration. Take with or without food, as directed by a healthcare professional. Adhere to the prescribed dosage schedule and do not exceed the recommended duration of treatment. Side effects. Gastrointestinal disturbances, nausea, diarrhea, allergic reactions, skin rash, itching, dizziness or drowsiness, hypotension, low blood pressure, headache. Toxicity. Excessive intake of cobamamide may lead to toxicity, including symptoms like nausea and dizziness. Overuse of thiocolchicoside can cause central nervous system depression and hepatotoxicity. Precaution. Monitor liver function tests during prolonged use. Avoid use if allergic to any component of the formulation. Exercise caution in patients with liver or kidney impairment. Interactions. Potential interactions may affect the efficacy of the combination. Drug interactions. Concurrent use with other muscle relaxants may enhance the effect, leading to increased drowsiness. Anticholinergic drugs may interfere with absorption. Food interactions. Cobamamide absorption may be enhanced when taken with food. Avoid alcohol as it may increase side effects such as drowsiness. Pregnancy use. Use of this combination during pregnancy should only be if clearly needed and prescribed by a healthcare professional, as there may be risks to fetal development. Lactation use. Caution is advised during breastfeeding, as components may pass into breast milk. Consult a doctor before use. Acute overdose. Symptoms of overdose may include nausea, vomiting, dizziness, drowsiness, and liver toxicity. Seek immediate medical attention if an overdose is suspected. Contraindication. This combination is contraindicated in patients with known hypersensitivity to either cobamamide or thiocolchicoside, and in patients with severe liver impairment. Use direction. Follow the prescribed dosage and frequency. Do not crush or chew tablets. Swallow whole with water. Storage condition. Store in a cool, dry place away from direct sunlight and moisture. Keep out of reach of children. Volume of distribution. Cobamamide, widely distributed in the body, particularly in liver and bone marrow tissues. Thiocolchicoside. Moderate distribution in tissues with a significant volume of distribution. Half-life. Cobamamide. Typically 6 to 9 hours depending on individual metabolic activity. Thiocolchicoside. Approximately 4 to 6 hours. Clearance. Cobamamide. Cleared primarily through the renal system. Thiocolchicoside. Cleared primarily through the hepatic route, with renal excretion of metabolites.